Do you take amlodipine, losartan, or lisinopril every morning? If you're over the age of 60, chances are one of these medications is part of your daily routine. Millions of people around the world rely on them to control high blood pressure and reduce the risk of heart attacks, strokes, kidney damage, and other serious health problems. But here's something many seniors don't realize. Taking your blood pressure medicine is only part of the story. Understanding how it works, what side effects to watch for, and when to speak with your healthcare provider can make a big difference in both your safety and your quality of life. Many older adults blame dizziness, swelling, a dry cough, or tiredness on getting older. Sometimes that's true, but sometimes these symptoms may be related to a medication, another medical condition, or even the combination of several medicines taken together. That doesn't mean your prescription is harmful. In fact, for most people, these medications are highly effective and can be life-saving. The key is knowing what is normal, what is temporary, and what deserves medical attention. In today's video, we'll compare amlodipine, losartan, and lisinopril in simple, easy-to-understand language. We'll explain how each medication works, discuss common side effects, clear up a few common myths, and share practical tips that can help you take these medicines safely. Most importantly, we'll answer the questions many seniors ask, but rarely get explained during a short doctor's appointment. Remember, this video is not a reason to stop taking your medication. Blood pressure medicines protect your heart, brain, and kidneys, and stopping them without medical advice can be dangerous. So stay with me until the end, because we'll also reveal several simple mistakes that many people make with their blood pressure medication, and how avoiding them may help you feel your best while keeping your blood pressure under control. Welcome to Dr. Bilal, where we make medical information simple, practical, and evidence-based to help you stay healthy, active, and independent after 60. Let's begin with amlodipine, one of the most commonly prescribed medications for high blood pressure, especially in older adults. Amlodipine belongs to a group of medicines called calcium channel blockers. It works by relaxing the muscles in your blood vessel walls, allowing the arteries to widen. As a result, blood flows more easily, your blood pressure decreases, and your heart doesn't have to work as hard. For millions of people, amlodipine is an excellent choice. It can help lower the risk of heart attack, stroke, and other complications of high blood pressure when taken as prescribed. However, like every medication, it can cause side effects in some people. One of the most common side effects is swelling in the feet and ankles. Many seniors assume this is simply part of aging or spending too much time on their feet. But in some cases, amlodipine can cause fluid to collect in the lower legs, especially after standing or sitting for long periods. Another possible side effect is mild dizziness, particularly when first starting the medication or after a dose increase. This can happen because your body is adjusting to lower blood pressure. Standing up slowly from a bed or chair may help reduce this feeling. Some people also report headaches, facial flushing, or a sensation of warmth during the first few weeks of treatment. These symptoms often improve as the body adapts. Although fatigue is less common with amlodipine than with some other blood pressure medicines, a few people do notice lower energy levels. If the tiredness is severe, persistent, or begins soon after starting the medication, it's worth discussing with your healthcare provider. It's also important to remember that swelling, dizziness, or fatigue can have many causes besides medication. Heart disease, kidney problems, vein disorders, dehydration, or other health conditions may produce similar symptoms. That's why you should never stop taking amlodipine on your own. Instead, keep track of your symptoms and share them with your healthcare provider. Sometimes a simple dose adjustment or a change in treatment can improve side effects while keeping your blood pressure under good control. Now let's move on to losartan and lisinopril. Although both medications are commonly used to treat high blood pressure, they belong to different drug families and have a few important differences that every senior should understand. Losartan, more than just a blood pressure medicine. Losartan belongs to a group of medications called angiotensin receptor blockers, or ARBs. It lowers blood pressure by relaxing blood vessels, making it easier for blood to circulate throughout the body. But here's something many people don't know. Losartan isn't prescribed only for high blood pressure. It may also help protect the kidneys in some people with diabetes and can reduce the risk of certain heart-related complications. That's one reason doctors often choose it for older adults with multiple health conditions. Most people tolerate losartan very well. However, some may experience dizziness, especially after starting treatment or increasing the dose. A few people notice mild fatigue or lightheadedness if their blood pressure becomes lower than usual. Losartan can also increase potassium levels in the blood. While potassium is an important mineral, levels that become too high can affect the heart. For this reason, your healthcare provider may recommend occasional blood tests, particularly if you have kidney disease or take other medications that raise potassium. Lisinopril, effective, but there's one side effect. Many people remember. Lisinopril belongs to a different group of medicines called ACE inhibitors. Like losartan, it relaxes blood vessels and lowers blood pressure. helping reduce the risk of heart attacks, strokes, and kidney damage. One of the best-known side effects of lisinopril is a persistent dry cough. This cough isn't dangerous for most people, but it can become annoying enough that some patients need to switch to another medication, such as an ARB like Losartan. Another possible side effect is dizziness, especially when treatment first begins. Like Losartan, lisinopril can also increase potassium levels and may affect kidney function in some people, which is why regular blood tests are sometimes recommended. Although rare, lisinopril can cause a serious allergic reaction called angioedema, which leads to swelling of the lips, tongue, face, or throat. If this happens, it requires immediate emergency medical care. The important message is that amlodipine, losartan, and lisinopril are all effective medications, but each has its own benefits and possible side effects. What works well for one person may not be the best choice for another. Now that you understand how amlodipine, losartan, and lisinopril work, let's discuss something that can be just as important as choosing the right medication, taking it correctly. Many seniors accidentally make small mistakes that can affect how well their blood pressure is controlled. Mistake number 1, stopping the medication. Because you feel better. One of the biggest mistakes is thinking, my blood pressure is normal now, so I don't need my medicine anymore. The truth is, in many cases, your blood pressure is normal because the medication is working. Always speak with your healthcare provider before making any changes to your treatment. Mistake number 2, skipping doses or taking them at different times. Every day, blood pressure medicines work best when taken consistently. Missing doses or taking them at random times can make it harder to keep your blood pressure stable. Try taking your medication at the same time each day. Using a pill organizer or setting a phone reminder can make it easier to stay on schedule. Mistake number 3, ignoring side effects. Some people experience dizziness, swelling, a dry cough, or fatigue, but never mention it because they assume it's just part of getting older. Instead of suffering in silence, tell your healthcare provider. In many cases, adjusting the dose or changing to a different medication can improve your symptoms while still keeping your blood pressure under control. Mistake number 4, forgetting lifestyle habits. Still matter. Medication is only one part of protecting your heart. Eating a diet rich in fruits, vegetables, whole grains, and lean proteins, limiting salt, staying physically active, maintaining a healthy weight, avoiding smoking, and getting enough sleep all work together with your medication to improve your overall heart health. It's also a good idea to check your blood pressure at home if your healthcare provider recommends it. Keeping a record of your readings can help identify patterns and ensure your treatment is working as expected. Finally, remember that every person responds differently to medication. The goal isn't simply to lower your blood pressure, it's to do so safely while helping you feel your best. If you're taking amlodipine, losartan, or lisinopril, remember one thing above all else. These medications are prescribed because they help protect your heart, brain, kidneys, and blood vessels. High blood pressure is often called the silent killer because it can damage your body for years without causing obvious symptoms. That's why treating it is so important, even when you feel perfectly healthy. Today, we learned that each of these medications works in a different way. Amlodipine helps relax your blood vessels, making it easier for blood to flow. Losartan not only lowers blood pressure, but can also help protect the kidneys in some people with diabetes. Lisinopril is another effective option that has helped millions of people reduce their risk of serious cardiovascular disease. We also discussed some of the side effects that many seniors may experience, including ankle swelling, dizziness, a dry cough, or fatigue. The important thing to remember is that these symptoms are not inevitable, and they don't happen to everyone. If they do occur, don't ignore them, but don't stop your medication without medical advice either. Instead, pay attention to how you feel. Monitor your blood pressure if your healthcare provider recommends it. Attend your regular checkups and let your doctor know if you notice new or worsening symptoms. Sometimes a simple adjustment to your treatment plan is all that's needed to improve your comfort while continuing to protect your heart. It's also worth remembering that medicine works best when combined with healthy daily habits. Eating a balanced diet, reducing excess salt, staying physically active, maintaining a healthy weight, getting enough sleep, avoiding tobacco, and limiting alcohol can all help improve blood pressure control and reduce your risk of future complications. Most importantly, don't compare your medication with someone else's. The best blood pressure medicine is the one that is safe and effective for your individual health needs. What works well for a friend or family member may not be the right choice for you. Thank you for spending your time with Dr. Bilal. I hope today's video has helped you better understand your blood pressure medication and given you the confidence to take an active role in your heart health. If you found this video helpful, please give it a thumbs up, subscribe to the Dr. Bilal channel, and turn on the notification bell so you never miss our latest evidence-based health videos designed especially for adults over 50 and 60. Until next time, take care of your heart, stay informed, stay active, and remember, the more you understand your health, the better equipped you are to protect it. Thank you for watching, and I'll see you in the next video.